Welcome back to Mediklaas, TNM Staging of Oral Cancer. What is cancer? It is a group of disease involving abnormal cell growth with the potential to invade or spread to the other parts of the body. This is a normal cell. This is an abnormal cancer cell. The TNM system is most universally accepted prognostic system due to its relatively simple design and user-friendliness. Importance of TNM staging. It helps in planning the proper treatment, to estimate the patient prognosis, and knowing the stage of cancer, which is important in identifying the clinical trials that may be suitable treatment option for a patient. Now, what does TNM stand for? T is for primary tumor, N is for regional lymph node, and M is for metastasis. Let's start with T. Tx is the primary tumor that cannot be accessed. TO is no evidence of primary tumor. This is the organ and there is no evidence of tumor, hence it is called as TO. TIS is carcinoma in situ. Carcinoma in situ is a group of abnormal cells that are formed only in place where they form in the body first. T1, the tumor measuring less than 2 cm in its greatest dimension. So for example, if the tumor is on a tongue, it should be less than 2 cm, then it is known as T1. T2 is tumor measuring 2 to 4 cm in the greatest dimension. T3 is tumor measuring more than 4 cm in its greatest dimension. Now for oral cavity, the Tpart is further classified as T4A and T4B. T4A is moderately advanced local disease. This tumor invades the adjacent structures, the cortical bone, the muscles of the tongue, maxillary sinus, and skin of the face. T4B is very advanced local disease. In this, the tumor invades through the masticator space, pterygoid plate, and the skull bone. Let's see the Npart. NO, N1, N2, which is divided into N2A, N2B, and N2C, and N3. So NO is no regional lymph node metastasis. There are two organs wherein there is no regional lymph node metastasis. N1, metastasis in a simple ipsilateral lymph node 3 cm or less in greatest dimension. Here you can see one lymph node is affected. N2A is metastasis in a simple ipsilateral lymph node greater than 3 cm and 6 cm or less in greatest dimension. N2B is metastasis in multiple lymph nodes more than 6 cm in greatest dimension. N2C is metastasis in bilateral or contralateral lymph nodes more than 6 cm in greatest dimension. So here you can see in both the organs, the lymph nodes have metastasized to the other parts of the body. N3 is metastasis in the lymph nodes more than 6 cm in greatest dimension. Now let's see the Mpart, that is the distant metastasis. MO is no metastasis. Consider this as lung, bone, and liver. When there is no metastasis to the other body parts, it is MO. M1 is distant metastasis, wherein there can be metastasis to different parts of the body, example lung, bone, liver, etc. Now let's understand what is metastasis. It is the cancer spreading to different body parts from the primary site. Metastasis is a complex biological cause that begins with detachment of the tumor cells from the primary site or primary tumor, spreading into distant tissues or organs. Now example, this is the lung, which is the primary site of tumor. Through the bloodstream, it spreads to the other parts of the body. For example, it goes to kidneys, and here is the tumor that has been metastatized from the lung to the kidneys. Cancer is a group of disease that involves abnormal cell growth with potential to spread to other body parts. We have learned the importance of TNM staging. We have learned TNM staging in detail, including tumor, lymph node, and metastasis. You can find the link to the MCQs for this topic in the description of the video. Thank you for watching the video. We hope you liked it, and if you did, please subscribe to the channel and hit the notification bell for updates regarding our new videos. See you in the next video. Till then, stay healthy and have an amazing week.